everyone. Thank you for joining us. My name is Kenneth Varner. I'm the Community Engagement Coordinator with Healthy Schools Campaign. Thank you for being here promptly at 3:30. We're going to give a few people just a couple of more minutes to log on and get settled, and then we're going to get started. So we're going to get started in about 2 minutes. Again, thank you for being here, and we will be getting started shortly. For those of you that just joined us, you are definitely in the right place. Thank you for being here, and we're going to get started in just another moment. Hello, everyone. My name is Kenneth Varner. I'm the Community Engagement Coordinator with Healthy Schools Campaign. Thank you for joining us on our webinar, Addressing Chronic Absenteeism with Healthy School Environments. Again, a little bit about myself. I've been working with Healthy Schools Campaign for about 1.5 years, going on 2 years actually. And before I was in this position, I was working as a health coordinator on Chicago's South Side. I arranged for mobile dental vans to visit the school, took children on field trips to get glasses, and also arranged monthly health challenges. So I'm quite familiar with helping schools to create healthy environments. So we are going to be getting started. Also on the line, I have my colleague, Rosa Ramirez Richter, and she will be presenting as well, and I'll be letting her introduce herself just a little bit later. As we get started, I want to tell you what to expect from this webinar. The webinar will run for approximately an hour. A recording of this webinar will be available online, and we will be sending that to you via a follow-up email as well. I do have a polling question that I am going to be asking you, so if you could answer that when it does pop up on your screen, I would greatly appreciate it. And then at the end of the survey, there should be at the end of the webinar, there should be a survey. Please fill that out. It'll only take a moment. All right. So before we get started, and as I introduce, tell you a little bit more about Healthy Schools campaign, I would like to know exactly who we have on the call thus far. So if you could please answer this poll question, I'll give you a moment to do that. So I just want to see if you're a part of the administration, if you're a teacher, parent, school staff, community member, or a partner. So if you work with the school as one of their partners, or if you are a concerned member, part of the wellness team, you can fill that out. I greatly appreciate it. All right, so our session, the objectives for today, we want to understand and address the health-related factors surrounding chronic absenteeism. We want to learn ways schools can incorporate health and wellness into their school improvement plans to help increase student attendance. And we want to learn the practical ways schools can leverage CPS wellness policies to promote student health and wellness and attendance. All right, looks like everyone has answered. Thank you very much. So I just went over the session objectives for today. And now I'm going to tell you a little bit about Healthy Schools campaign. We are a local nonprofit that works on local and national issues around school health. We believe healthy students are better learners, and we work hard to make changes at the local, state, and national levels. We work with CPS to offer healthier school food and advocated for the return of recess. We've encouraged school districts to use green cleaning products as well as hosted healthy cooking contests across the city. We're really finding ways to engage administrators, staff, teachers, parents, and students to help encourage them to be more healthy. We recognize that students face many barriers to learning that aren't directly academic, and our mission is to work with schools to create healthier environments that address those non-academic barriers to learning. Again, we know healthy students are better learners, and all children deserve the opportunity to be healthy and successful. So what is a healthy school? When I think about a healthy school, I like to think of it as a school that provides the wraparound services and the environment that addresses those non-academic barriers to learning. Schools that provide services such as dental and vision screening and treatment, as well as mental health support. It's a school that recognizes the connection between health and academic performance and makes nutrition education and physical education integral parts of the school day. Basically, it is a school that considers the whole child when making decisions on how best to educate them. And it looks like a good amount of the people that we have on our administration, so welcome. We have some community members or partners that are on here as well. So thank you very much for being here and joining us. And with that, I would like to turn it over to my colleague, Rosa.
Hi, everyone. This is Rosa Ramirez-Richter. What I wanted to share with you today was, so on the next slide, this is a really busy graphic, but what it illustrates is, the 30 years of research shown, the connection between educationally relevant health disparities and, and how to close the achievement gap. So there's this professor out of Columbia University called Charles Bosch, and he has dedicated his whole career to identifying causal links between educational outcomes and the health disparities. So on here you can see things like, obviously, vision and hearing is connected to the sensory perception of a student, or cognition, or asthma is connected to something as simple as absenteeism, coming to school. And so what he really narrowed down was evidence-based, school-based, evidence-based programs that can have a direct link to motivation and the ability to learn for students. And so their sensory perceptions, cognition, their connectedness, their engagement in school, actually getting them to school. And what he argues that is that in order to address the academic achievement gap, we must address these health disparities. Now, of course, he's understanding that not all schools cannot address everything at one time, but he does make the case that there are programs to implement and strategies to implement to get at one of these, educationally relevant health disparities to really reverse those patterns. So on the next slide, you can see, this webinar obviously focuses on chronic absenteeism, but he lays out a whole bunch of direct link ways of how we can have programs or strategies based on asthma, vision, dental, and health that can increase student attendance and address chronic absenteeism. We'll come back to that in a second bit, but I wanted to really frame that of, all of the initiatives intended to, increase educational success for our students, may be missing the mark if we don't address basic health conditions in our students. And so on the next slide, we first wanted to level set and talk about chronic absenteeism. Now, Chicago Public Schools does use this definition. This is a definition by a group called Attendance Work, and they define chronic absenteeism as missing 10% or more of school. So that comes out to like 17 or 18 days out of the school year. But it could also, if a student is missing 2 times a month, whether it's excused, unexcused, or if it's, an out-of-school suspension or suspension, it doesn't matter the cause or the reason, as long as they're missing out of school, that student would be captured under the term chronic absenteeism. So it really is different from your daily average attendance or other attendance rates that districts may have different ways of calculating. This is a really comprehensive way of getting at all the students that may be falling at academic risk. Next slide. And so this is another nice graphic about, this is produced by Attendance Works as well, talking about, what are all the factors contributing to chronic absence? And of course, as you are educators, you're on the front line, intrinsically everything, but this is an exhaustive list that they've really researched into it, whether, it's unsafe getting from home to school, those are certain barriers, there's negative school experiences, or they just don't feel connected to the school culturally, or they don't feel welcomed, don't have a strong adult ally, things like that. Next slide. But we do know that health issues are a leading cause of chronic absenteeism. And chronic absenteeism is such a complex topic, and we don't want to make light of it. And this is why we're just dedicating this webinar to talk about the health-related issues of it. It is definitely one of the top reasons why students are missing. And some of the health-related conditions that result in missing school, one of the top ones is asthma and dental health. So again, underscoring the importance of school-based dental programs, like, for example, CPS does partner with the Department of Public Health, and they provide dental service to students at no cost to the youth or their families at their school. So even showing more importance of taking advantage of these programs that are available at school. Another one is obesity-related issues. From, it might seem contradictory, but having adequate access to nutritious foods. Sometimes students do go missing from school because they due to hunger pains, and they may be filling up on the wrong kind of food, or they just might be having chronic conditions related to obesity, like sleep apnea, mismanagement of diabetes, and things of that nature. Next slide. So again, this just actually summarizes what I just said. And on the next slide, I think this really underscores what the impact is on our students. And again, we're just level setting. We know that this, children who are chronically absent starting in kindergarten, and first grade. They're much less likely to be reading at grade level by third grade. Also have a higher chance to dropping out of high school. And also chronic absenteeism is one of the leading indicators, whether they're that dropout indicator. But we know that education is such a predictor of adult success that it also predicts adult health outcomes. So that's another way that we're going into both fields, the education and the health center. Next slide. So again, across the nation, those most affected by chronic absenteeism and the educational outcomes that result in that is, students that come from low-income families, Native Americans, and African American children do have significantly higher rates than white students, and particularly in states like Arkansas, and also our our Latino, Latinx students who have higher rates in states, again, like Arkansas and Louisiana. And of course, students with our disabilities have, just in general, in all states, have higher rates than others. Next slide. And, so noteworthy with the Every Student Succeeds Act, the new educational law of the United States, it requires states to include a non-academic indicator on their school report cards. Illinois has chosen chronic absenteeism as that indicator. So now any school or any parent, anyone who cares about education can go online and look up the chronic absenteeism rates for their community. Next slide. So again, underscoring the work here in Chicago, 1 in 5 students have missed school or are chronically absent in just the last school year. So, and on the next slide, coupled with that rate and the rate of obesity, we know this is a very important issue to address. And again, we're just taking one angle of this and looking at the health-related causes of chronic absenteeism, and I'm going to pass it back to my colleague Kenneth to talk about going deeper some of the strategies to decrease those absenteeism rates.
So as we're looking at this map, just to further explain what that is, so we see here it says 43% of students are considered to be overweight or obese. This was a study that was done in 2010-2011 school year. And we all know the highest prevalence of obesity leads to other health issues such as asthma and diabetes, as Rosa was just explaining. And if you stay home because of a condition or you have to see a doctor, that is time that you're not in the school building getting that proper education. So we see 43% of the students across all of CPS are overweight or obese. And where we see the highest prevalence are where you see the darker shades of blue. And notice where those are gathered. You'll see that on the west side, the southwest side, and the south side. So the darkest color would be, I'm not sure how we see it, the 47 to 53% of those students are overweight or obese, and the lightest blue would be less than a third. So you're looking at your darker colors in the southwest side, your lightest colors in like the Lincoln Park, just north of the near north side areas. So what do the darkest colors, shades of blue, have in common in those neighborhoods? Those are going to be your lower income neighborhoods, your food deserts, high crime, like west, southwest sides. And what are the demographic of those neighborhoods? Those are where you're going to find African American and your Latinx communities. So when you're putting these things together, it's not just a health issue that we are noticing, but it's a social justice issue as well. And so when addressing those health-related issues, asthma is a leading cause of school absenteeism, accounting for a third of all days missed in instruction. Best practices and proven interventions include comprehensive asthma management programs. So making sure that the adults in the building know exactly how to best support a student with asthma. So that comes from their planning as the adults getting together and having a plan with the school nurse, and everyone in the building should know where their inhalers are and how to and have an emergency plan. Also, educate the children on how to manage their own asthma. So if they have to walk around with their pump, teaching them to recognize the signs of an asthma attack so they can be preventative instead of just reactionary. And you also want to monitor the indoor air quality of their school and the cleaning products that you use. So a lot of products that exist in our world can actually exacerbate those and trigger asthma attacks. So we want to be mindful of the environment in which that we're putting our students in. So making sure that they have an environment that is best conducive for their health. Also, we want to pay attention to the oral health practices and proven prevention. So making sure that your students are getting those dental screenings and sealants and preventing any sort of like caries that may exist. I know in my experience working on the school that I mentioned earlier, I had students that were constantly having headaches, not paying attention in class. Eventually they would come to me and say they need to see a dentist. And one student ended up having a cavity the size of an M&M in their tooth. And once we were able to get him into the dental van, he was treated. The student's headaches went away, toothache went away, obviously, and ended up being a much better student, was able to pay attention, was able to focus in class, wasn't as irritable, was able to be more engaged in a positive way. So we're making sure that our students are getting these wraparound services that can prevent other issues and lead to better academic performance. Food insecurity, this is something that Rosa mentioned earlier. Best practices to address that is making sure that students can get healthy breakfast in the morning using the breakfast after the bell program. So even if your student does show up late to school, making sure they can have that healthy start to the day. Think about yourselves when you haven't eaten all day and you're sitting in conferences and you're sitting through webinars. Like, how is your mentality? Like, how do you feel when engaged with other people? All right, you might be slightly more irritable, less likely to be able to focus, can't pay attention. So yes, you want to make sure, like, schools can be the place where students get the majority of their meals. When you think about breakfast, lunch, and sometimes even in the after-school programs, that's providing the dinner. So let's make sure that those students are taking full advantage of those. And then when you're thinking about behavioral health, you want to also think about those wraparound services where you can have students are able to see a counselor. When students' behavioral health needs are met, they're less likely to be absent and more likely to be engaged and have a sense of connectedness to the school. A total of 13 to 20% of children experience a behavioral health disorder in a given year. So making sure that they are in touch with those services that they need. And also being trauma sensitive. And here I really want to focus on or mention that it is not only the students that can be traumatized, giving their households or the neighborhoods that they live in. It is the teachers that can also are from these neighborhoods or are living in these neighborhoods. The same things that traumatize the students are the same things that are traumatizing the adults in the building. So it's important that we are all aware of the trauma that has been inflicted upon us and that we are doing the best to take care of ourselves. So I really want to mention that staff self-care is important. Think about when you're on an airplane and they always say, make sure that you put on in case of emergency, put on your mask first before you put on the mask of someone that is depending on you. If you're not taking care of yourself, you're not going to be in a position to take care of those that depend on you. So staff care is very important. So make sure that you're getting the help that you need as well. And with that, I would like to turn it back over to my colleague, Rosa.
Okay, great. Thanks, Kenneth, for really illustrating those examples. I mean, I think overall what we're seeing in this webinar is that it's a critical strategy for addressing these health-related reasons behind chronic absenteeism is creating a health-promoting school environment. That's really at the essence of what we're trying to deliver here. And so on the next slide, you know, you may already be aware of this, but CPS does have these 4 health-promoting policies. You know, there's the wellness policy, that governs everything from school food to nutrition education to a host of other policies. The healthy snack and beverage policy is this fundraising and snack vending policy, as well as the physical education policy that is minutes per week or daily PE stance on that all students should have access to physical activity. And again, connecting it back to what Kenneth was saying, is creating that school climate where, students feel they are cared for in this environment. So specifically, that breakfast after the bell policy has just these immediate direct impacts related to student attendance. So just much more stressing the importance of implementing these policies or getting the resources to help your school implement them. So on the next slide, you can see that CPS does have an indicator. It's called the Healthy CPS Indicator, and each of these 4 icons that you see there represent a whole host of policies around, chronic disease management to, fundraisers to physical education, nutrition education. And it's a way to really recognize schools that are going above and beyond in creating these health promoting school environments. And really, again, it's another way the district is saying that this is important and healthy students are better learners, and trying to close that gap between education and health. Next slide. Again, there's a whole host of science and research related to good quality nutrition programs and attendance, in particular, again, that breakfast and and having that impact on educational outcomes. I think there's no school in the United States where right before a big test is taken or there's a state test exams being taken, that there's that letter being sent home telling the parents to put their children to bed and make sure that they get a good breakfast right before the test. So again, this is just saying we should do that all year round, not just on test day or test week. There really is a significant body of research around this. So in the next slide, another key area is movement. How do we create physical activity opportunities for our students, throughout the school day? There is some really interesting neuroscience about the intensity of how much physical activity students get and the frequency and the educational outcomes that really has some impact on how you may want to schedule PE, before a more difficult course for students or before an exam. So they're saying that bout of physical activity really wakes up, the brain and has students improve their on-task behavior and test higher on specific tests. So on the next slide, this is to say physical activity should be thought about in a comprehensive way. The goal is to get to 60 minutes a day for students. And just in general, that's like the recommendation by the CDC. But, physical activity opportunities are really at the first and foremost come through physical education. And then we can talk about recess. And the best evidence-based practice there is to schedule recess before lunch. Why? Because students will behave better and they will eat their lunch, and there's less waste that happens if that's done. And obviously a lot of schools offer daily recess, but making sure that actually happens even on cold weather days. Children can be out there in the cold for very specific weather guidelines that CPS abides to. And then integrating movement in the classroom is really the last step of thinking about this comprehensive school physical activity programming. So some schools that we've worked with have, every morning on the intercom, they all do like a 3-minute fitness routine together as a school, again, creating that culture, that school climate of care, but also of valuing physical activity. The next slide. And so another key way here locally is to integrate these health-based strategies aimed towards decreasing chronic absenteeism by including it in your continuous improvement work plan. Now, we know that you're in the midst of it, but you absolutely can amend it, or for the next cycle, go, really have a targeted strategy that includes all these health-related strategies into it. and we have resources at the end that we'll share around that on the next slide. So again, schools that are creating this health promoting environment will have these decreased rates of student absenteeism, fewer behavioral problems, and higher educational outcomes. On the next slide, but if there are specific strategies you are looking for different populations, Attendance Works, which is the graphic that we pulled this from, has a great website that you can go in there, and they have a really neat way to think about, strategy. So they call this graphic their key ingredients for success, and for success for systemic change. So one key part is positive engagement. So again, creating that culture of attendance, but always making it positive, not punitive, and helping everyone understand why going to school every day matters and what they can do to ensure students are in school. And so if you click on their website, you can go by category and get specific resources. So under, shared accountability, school principals are more likely to pay attention to chronic absence if it's built into systems that they already have. So at CPS, we have that dashboard. We can really use that data to have these conversations with our staff teams or people on the ground and highlight that. Of course, there's multi-tiers approach to reducing absenteeism, and they do a really nice way of, if you're looking for targeted approaches for a tier 1, these are strategies that apply to all students in the school building. But if you're looking for more strategies for students that are severely, chronically absent, then you can look at those strategies there. But just wanted to point out this resources. It's so rich with great information. On the next slide, you can, we included a few examples that we thought were notable that might be worth looking into. And again, you can read more about these specific locales on the Attendance Work website. We'll send out the slide deck and you can see it specifically there. But in Phoenix, Arizona, they had a very big chronic absenteeism problem. They launched an initiative, but there they really focused on creating a positive and safe school climate. And the way that they did it, surprisingly, not to us, but maybe for you, is that they partnered up with the organization called Playworks to really create that positive school climate around recess. And it was a great way to get students motivated to come to school, create that school connection, and they were able to decrease their chronic absenteeism rates quite significantly. And then, another notable one was in Long Beach, California. They really relied on their partners to focus on the schools with the highest chronic absenteeism, and it became part of this district-wide campaign. In Cleveland, Ohio, they had a great initiative that really focused on creating a strong social and emotional learning practices at the school level. And so they had a very direct approach of working with the principals and teachers on what trauma-informed practices were and developing the social and emotional skills at the school level. And they also were very key in having like a social media campaign to really talk about the importance of student attendance. So that was pretty notable. And then in New Britain, Connecticut, this is one of the poorest school districts in Connecticut, and they were able to really target specific resources to reduce the chronic absenteeism among the youngest students. So here they focused on, they had an alarming rate of 30% of kindergarteners were chronically absent. And so with that information, what the district and the community partners did, they launched this really comprehensive campaign where they had school attendance teams, and these teams were responsible for providing professional development to community partners and the school teams, and delivered chronic absence data reports every 10 days. to keep everyone from the administrators, educational leaders, to the parents accountable. And they had a really extensive parent engagement program and this interagency case management for the most challenged students. And so it was a huge success. I think it was even reported in the New York Times. And what it led to was now that there's this huge data portal at the state level where you can really monitor absenteeism at the school level. So there's some pretty interesting strategies there that show the success both of thinking about how health-related strategies can decrease that chronic absenteeism rate, from that example of partnering up with Playworks, this recess-based organization, to thinking about the strategies of using data and having a deliberate strategy across the district. So I hope that gives you a little bit of what's happening at the national level. On the next slide, we included a whole host of resources. Again, this is the Attendance Works, the key ingredients for success, and from there you can see these case studies as well. We also are including a guide of how to include health and wellness with an eye towards reducing chronic absenteeism in your school improvement plan, and also a toolkit addressing these health-related causes of chronic absenteeism. We also included our parent engagement guide that has a whole set of resources on how to talk to parents about these issues, but also how to engage them in creating that health-promoting school environment at your own school. So with that, we'll pause here. I'll return it back to Kenneth. I think there's a few housekeeping items there. Feel free to chat us some questions at the moment.
Thank you, Rosa. Yes, if you have any questions, please feel free to chat at us, and we'll try to answer as many of those as possible. Just to reiterate, we also will be sending out a recording of this webinar. So please share this with, if you're a teacher, please share this with the administration and other teachers in the building. Administration, please share this with your teachers. If you cannot think of any questions at the moment, or if someone else has a question, one of your colleagues has a question, please let us know. This is both Rosa and I's email address that you can contact us at any time, and we'll get back to you. One thing I also did want to recommend for those of you that are working to create a healthier environment in your school, if you're looking about how to start that, Rosa recommended adding some health and wellness practices into your CIWP, or Continuous Improvement Work Plan. I would also like to recommend that if you do not have a wellness team as of yet, please start a wellness team so that you can have designated individuals that are looking into these matters and creating that healthier environment. Example of people that can be on your wellness team: one, you need a wellness champion, someone that is on the school staff that can take the lead on this. This also works to achieving those the healthy CPS badges that Rosa had mentioned. You can have your school nurse be on the wellness team. You definitely want parents to be involved on your wellness team, and any community members or community partners can meet once a month or so, but they can discuss things on how to create those healthy environments and how to arrange for the mobile dental van, how to create those health challenges and get everyone on board, and to get buy-in from teachers and students into creating those healthier environments. They can brainstorm on having healthier celebrations and fundraisers. So definitely, if you do not have a wellness team, please look into getting one of those started at your school. So, Rosa, is there anything else that you would have to add here?
No, just that, we're happy to help. We are working with a set of different states across the country around chronic absenteeism. So, this was a very, high-level, informative webinar, but if there's something that piqued your interest and you really want to learn about, we're happy to jump on the phone or come visit your school and talk more in depth. So thank you so much for making time today to listen in.
And yes, thank you very much for taking time. We do have a couple other webinars that will be coming up in the near future. On March 6th, we'll be doing a webinar on implementing the physical education policy. And then later on in April, I believe that'll be the 23rd, we're going to be doing a webinar on preparing for the Healthy CPS survey that will be coming out in the spring, which will then dictate the badges that you would earn for the next school year. So please stay tuned for that. Again, thank you very much for participating and enjoy the rest of your day.